I want to thank you all for joining us here. And before I get into our remarks and we begin this press conference, there's a bag of red ribbons on the back table back there. And they're there for a reason. My office thought over the weekend, and we came up with a way that we want to acknowledge our frontline workers, our doctors, our nurses, our teachers, our police officers, our firemen, our grocery store clerks and truck drivers, everybody that's on the front line helping to get us through this Corona-19 situation that we're in. And I'd encourage you to take one, and if you're here from a TV station, take a couple extras and give them to your on-air personality so that when I'm watching, I'll see them wearing red ribbons, and everybody in our community knows that we're all going to be supporting them. Thank you. I want to begin by thanking all Nevadans who have been staying home for Nevada. You're doing your part, and I want you to know how much I appreciate it. For those of you who aren't doing your part, I want you to know how much I'm disappointed in that as well. Every person that participates is improving our ability to flatten the curve. It's extremely important. You know, one person or a couple folks that get together and don't want to follow the rules are making it more difficult for the rest of us. For if we want to get through this as quickly and as safely as possible, I encourage everyone to participate. As a state, we are taking informed, proactive, and necessary measures to protect each other and mitigate the spread of this virus. While all these measures have created hardship for many in the short run, these decisions have been necessary to help us flatten the curve faster. I'm uplifted every day by the examples I see of my fellow Nevadans who are staying home for our state and helping their families and their neighbors do the same. You see the good work that's being done by restaurants that are donating food, folks that are running errands and picking up groceries and prescriptions for their neighbors and the elderly. That's heartwarming, and it's something that we all need to do to get through this together. I'd now like to give an update on our general situation in Nevada, and then I'll be turning it over to Major General Berry in a bit so he can provide you with an update as well. There's be slides on our board over here to my right. As of today, can we get the slide up there? There you go. As of today, 1,953 individuals in Nevada have tested positive for COVID-19, while 15,676 have tested negative. To date, Nevada has received the following from the federal government: 3,000 reagent kits for testing and 4,000 test swabs. While we appreciate whatever testing components we get from the federal government, at this time the reagents, swabs, and are not nearly the volume necessary for us to perform the desired amount of testing that we want and our citizens want. That's why we continue to aggressively explore testing expansion options with our labs right here in Nevada, including Dr. Mark Pandori of the State Public Health Lab, who is working to assemble testing kits in northern Nevada. We're going to work to get them assembled here in southern Nevada and spread those out around the state. But until we can widely expand testing throughout Nevada, it remains absolutely critical that we all continue to stay home for Nevada and practice safe, strict social distancing. I'm going to repeat that one more time because it's one of the most important things I'm going to say. It's absolutely critical that we all continue to stay home for Nevada and practice strict social distancing. As of today, we have 117 new positive cases. As you can see, our total cases have steadily increased since the end of March to that total of 1,953 cases today. As we get more data on testing results, our medical advisory team will advise me on potential future steps to ensure we're flattening the curve as effectively as possible. So far, we have lost 46 Nevadans to this virus. I know our hospitals are working overtime to keep Nevadans alive and help them battle this disease. As you can see from yesterday till today, we did not lose a single life. That's because our amazing doctors, nurses, and other healthcare professionals are on the front line. That's why I encourage you to wear a red ribbon to say thank you to them and give them some moral support along the way. They're staying your work for us. We need to stay at home for them. In terms of acute care demand statewide, hospitalizations have been stable at 61% staff-occupied beds. ICU occupancy is at 74%. 282 COVID-19 patients are in Nevada hospitals statewide. Ventilator use has increased slightly and is now at 44%. There are 838 ventilators statewide. 372 of those ventilators are in use. We have an order submitted to FEMA for an additional 450 ventilators and have been told to expect delivery 72 hours before what they're deeming a surge. The state is working with FEMA to monitor the usage across the state and the potential surge date. According to the Nevada Hospital Association, staffing levels have been stable at an overall level of green. The state and its many partners have worked overtime, and I want to thank my staff for doing such an incredible job here to get as much PPE materials distributed as possible to our local hospitals and healthcare workers as quickly as possible. I'm going to run these numbers by you. As of today, the state has distributed 22,014 gowns, 76,295 gloves, 84 coveralls, 736,860 N95 masks, 206,500 surgical masks, and 23,424 face shields, a total of over 1 million PPE items distributed to our hospitals and healthcare providers. According to the Nevada Hospital Association, PPE is currently at an overall level of yellow. This means that while PPE is being used and more is being distributed, we need to continue to aggressive efforts to attain and distribute more as the need increases. Note that these figures include received shipments from federal government as well as what the state had on hand in our existing stockpile from instances in the past, such as the H1N1 epidemic virus. These numbers do not include private donations at this time. In the future, we're looking to provide cumulative numbers that include federally received, state purchased, and privately donated. Now I'm going to cover a brief few updates. A lot of Nevadans have stepped up in recent weeks to donate PPE to local hospitals and those that need proper materials to keep safe and healthy as they battle COVID-19. This week, guidance on donations that are shown on this slide will be issued. It includes what donation items are needed, such as unexpired N95 masks, surgical masks, medical gloves, gowns, and more in their original packaging material. To make a donation, email donations@nvhealthresponse.nv.gov. From there, a volunteer will assist in making sure your donation goes where it is needed the most. Face coverings, like this. On April 3rd, my medical advisory team issued guidelines for using a face covering as a precautionary measure to prevent the spread of COVID-19. A face covering is not a surgical grade or FDA mask like an N95, which is in short supply and should be reserved for those who need them the most. The medical advisory team has clearly stated that face coverings reduce the spread of COVID-19 from infected individuals, even if they are experiencing mild symptoms or no symptoms at all. A face covering protects your neighbors and those you love. We ask all Nevadans to wear an improvised face covering whenever they leave home and interact in public spaces. On Saturday, in coordination with the Nevada Health Response Center and Nevada DHHS Public Health Preparedness Division, I called on healthcare providers, behavioral health professionals, and administrators to join the Battle-Born Medical Corps to help expand Nevada's medical care capacity during the COVID-19 crisis. This directive waives certain licensing requirements to allow Nevadans to quickly bring additional health care here to our hospitals. It also permits certain doctors, nurses, EMTs, and even medical students to go to work immediately to care for COVID-19 patients. Those interested in joining the Corps should visit serve, servnv.org. That's servnv.org. SERVNV, there's no E, SERVNV.org. Now I'm going to turn it over to Major General Andrea Berry to go into the details as it relates to the National Guard. General.
Thank you, Governor. So at this time, I want to outline the 5 specific goals our team is following as we proactively respond to COVID-19 in Nevada. Goal number 1, we really want to minimize the number of deaths and mitigate the spread of COVID-19 in our state. Number 2, acquire sufficient personal protective equipment, or PPE, to protect medical personnel, first responders, and essential workers. Number 3, to expand testing to provide usable information for decision making. We make our best decisions when we expand. Number 4, to create an efficient and coordinated information flow within Nevada state institutions. And number 5 is to ensure that the public is informed and updated consistently on the strategy developed by medical and emergency experts. It is critical that we follow these 5 goals. And we believe when we follow these, we can best place our state in the position to do what's right and best for our citizens. Now, I just want to briefly talk about some of the things that we have done as a Nevada National Guard to ensure that we are best aligned to the governor's strategy. The first thing that has happened is the major disaster declaration was approved Saturday, and it opens the door to use Nevada National Guard military personnel and assets with federal funds to respond to the COVID-19 outbreak in Nevada. Now, the Nevada National Guard, or the National Guard, activates under 2 statuses. The first is Title 10, which are activated under the President of the United States. The second is Title 32, which is the National Guard under the direction and the leadership of the governor. The governor is the commander-in-chief under Title 32. So as part of the Master Disaster Declaration, the President approved and will be signing the approval of federal funds for the Nevada National Guard. We expect that to happen at any time. This does not assign missions to units. All Nevada National Guard missions must be approved by FEMA, and we align it with the governor's strategy. And that is what we're currently doing. In addition, we're talking about the Nevada National Guard. We have activated the Joint Operations Center in Carson City. This is part of our domestic operations. We've also established liaisons for appropriate agencies to enhance information distribution. This ensures clarity. We've also instituted teleworking measures for our soldiers, airmen, and civilian employees to ensure we continue to practice social distancing. We must be the example and the role models. We've also established health protection measures and medical screening personnel at state military facilities. This is important that we have to take care of ourselves before we can take care of Nevadans. And today, we just activated 100 soldiers and airmen to support donation management and logistic missions in northern and southern Nevada. It is critical for people to understand this is not martial law. The Nevada National Guard is comprised of your neighbors helping neighbors. We work here, we live here, we are Nevadans helping Nevadans, and that's what we do best. The National Guard, always ready, always there. Turn it back over to you, Governor.
Thank you, Major General Berry, for your leadership during this difficult and challenging time for all of us. In addition to asking you all to wear a red ribbon to show your thanks for our first responders and frontline workers, I'd like to talk about something new that we're going to do to highlight the great work being done throughout our state. We would like to encourage you to nominate a Nevada hero, a teacher, a doctor, a nurse, a police officer, or someone in your community that is making a real difference in our effort to stay home for Nevada. You could submit their name along with a couple of lines describing why you think they are your hero to NevadaHeroOfTheDay@gmail.com or by calling 775-687-0437. That's NevadaHeroOfTheDay@gmail.com or by calling 775-687-0437. If possible, please provide a picture of them and any other pertinent information that would be helpful in identifying them or telling a little bit about their story. They will be recognized on our social media platforms, in a daily news release, and other public forums. With that, I'd be open to take any questions if anyone has any.
Governor, thanks for your time. You mentioned that our hospitals are currently in a state of yellow. We've heard from some hospitals that are actually reusing some of the PPE now. They're being asked to hand it in at night, somehow get sanitized, and they're reusing the equipment the next day. When do you anticipate we're going to get beyond this state of yellow? What are you hearing? What's your best case scenario here?
Well, the task force that was assembled that I assembled with Jim Mern leading it and a group of folks on it, and along with the significant donations that have been provided by Mr. Adelson and Matt Maddox from WIN and Bill Hornbuckle from MGM. A lot of that material is coming in. It got a little difficult to get some of these jets in here out of China right now. The material is on its way. We have some that's been delivered in the last 48 hours to our warehouses. And all that material that's been delivered will be distributed on an as-needed basis around the state. The general will be in charge of the distribution.
Maybe a different scenario in a week from now, hopefully?
I would certainly think you'd have a different scenario in a few days as it relates to some of the equipment, yeah. Jake?
Governor, thanks for your time. There's been a lot of talk about when states will reach the peak number of their cases. What's the best case scenario and worst case scenario for Nevada as far as the peak?
I've seen a lot of modeling, and I know a lot of statisticians, and I know a little bit about statistics, which probably makes it dangerous, and I know just a little bit about statistics. I've seen dates anywhere from April 10th, 12th till the middle of June, about when we're going to reach our peak. My concern is minimizing that peak and keeping as many Nevadans alive as we possibly can by reducing hospitalization, reducing intensive care units, reducing ventilator usage, and ultimately reducing deaths that come about as a result of COVID-19. And we'll continue to pursue that reduction. The statistics are going to bear out as they are, and I'm not going to get into the forecasting business of when we'll hit our peak day or when we'll be finally through a plateau. I'm just focused on every day doing everything we can to keep Nevadans as safe as we can. And the biggest influence in doing that is staying home for Nevada. Not having Easter dinner with 12 people coming over to your house and not playing a basketball game with 8 kids at the basketball court or meeting up with 6 kids to go skateboarding. The idea is stay home with your household, your immediate household, and prevent the spread of this virus. And then we'll be able to flatten the curve, and hopefully the peak will be something that'll be very flat. Yes, sir.
You said on MSNBC yesterday that the Feds told us to just go our own way and do our own thing. Now today they put out a press release including those figures that you mentioned about the 4,000 kits that they gave. What's the discrepancy there?
No, I didn't give us 4,000 kits. They gave us 3,000 reagent and 4,000 swabs.
You said that they told us to do that they weren't giving us anything on it.
They did not give us any kits. That's right. That is what I said. We did not get any complete kits. We've had our kits assembled by Dr. Pandori. You have to put the swabs, the tube, the plug, the reagent, all goes into a kit. So we haven't gotten any assembled kits. We got some components to kits, right? Yes.
Governor, thanks for speaking with us. You mentioned ventilators. Earlier, President Trump said Governor Gavin Newsom from California is going to give out around 500 ventilators, 100 of them supposed to come here to Nevada. Do you know a timeline on when those will arrive?
Okay, and I don't know if they're going to be able to pick up these questions or if I should be repeating the questions. The question was about ventilators, and I apologize, I'll start repeating the question. The question about, we asked for ventilators and Governor Newsom is sending us some ventilators back. I have not heard that any ventilators are coming to Nevada. Like I said, I was on a call again today for a couple hours. I again asked for ventilators, and we've got a lot of people doing everything we can to secure ventilators. Yes.
Governor, the large number of unemployment claims is causing the state unemployment website to crash, and claimants are also having trouble getting through by phone. How is the state responding to these problems, and what does the state recommend claimants do if they encounter issues?
And the question is as it relates to unemployment insurance claims and the frustration that some folks are experiencing getting through. I can tell you, I can assure you I'm aware of the frustration. I hear the anecdotal stories. I know for every person, if you're the one that can't get through, it's a big issue for you. That being said, we have processed over 250,000 unemployment claims. We do not have the structure in place, I can assure you of this, to process this kind of volume. This department, Dieter, has never received the funding that it should have received. You could never expect a surge in claims anything like what we're dealing with right now to handle this many claims. We're working to provide some, we've expanded our hours, we've added some people, we're working on some other solutions to bring in some more operators to deal with some of these calls. And I just encourage everyone to please keep trying, be as patient as you possibly can. It's not the fault of the individual that you get on the phone. The men and women that are working there are really doing a great job. It's just our capacity, our bandwidth. We're dealing with computer access, phone lines. There's just not enough access for this many calls that we're getting. So please keep trying. Your benefits will be retroactive to the initial day. Thank you. Yes, sir.
Governor, thanks for taking my question. I was going to ask about hydroxychloroquine and the update on it, whether we have enough supplies and the use of it.
Well, the question relates to hydroxychloroquine. We don't have a large supply of hydroxychloroquine. It's a very in-demand drug. You're hearing mixed stories between what President Trump is saying, what Dr. Fauci is saying, what other medical experts are saying, doctors are saying. I am not a doctor. I am not a pharmacist. I go on the advice and the information that's delivered to me through our medical professionals and our board of pharmacy. I do know that I have had a lot of people that are expressing great concern, that have a family member that is suffering from lupus, that this is the only drug that helps them, and that they're having a difficulty getting that drug because some people hoarded it and used it as a proactive measure in terms of COVID-19. There's been no evidence that I understand that there's been active for that. I continue to listen to our state medical board and our board of pharmacy as it relates to that. And if the situation changes and they give me other advice, I would bring that forward as soon as I get it. But to this date, they thus far have not done that. Yeah.
Governor, the general said that he's looking to expand testing. Do we know how many tests we need and how many do we have right now in the state between the state and also private facilities like Quest?
Well, you know, we don't have a lot I can tell you. I'm aware, I've read that UNLV runs out of tests that they had, I think, using them tomorrow. The state labs were now out of the extractions, nasal straws or tips that are used, swabs. So we are short of testing kits. There's a new testing coming out, the little box, I don't know what the name of it is. Yeah, the 15-minute one that we're supposed to hopefully get by the end of the week. But the Abbott lab, thank you, General. We don't have those yet. General, you have anything you can add to that?
Yeah, and we know from talking to FEMA today that they're trying to, they use a formula to say what should be coming into our state, and we are kind of challenging the formula they use, which is similar to the one the president uses, versus using our own personnel who work for the state, who really understand our demographics and our current situation, so we can better be positioned to acquire more equipment in a more expedient manner. So having said that, we're hopeful that when we get back to them this week that we'll be able to expedite getting more equipment and more PPE and more things that we need to have the testing that we need to really show what our true challenge is.
Do we know how much we need though?
Well, yeah. Well, we need a significant amount. We've got a little over 3 million people, 3.25 million people in the state of Nevada. So depending how many you want to test, the more people we test, the more positives we're going to get. That's just a direct correlation there. My biggest issue is how many people are hospitalized, how many are in intensive care units, and how many fatalities, and how many go down to ventilators, because they kind of go down that road there. So would we like to do more testing? Certainly, but I can tell you one thing that's absolutely sure, I'm going to get a lot more negative tests if everybody would just practice safe, these social distancing protocols, if they'd stay home for Nevada, if they would avoid groups of 10 or more, if they'd cough into their elbow, if you'd wash your hands a lot, we'll get a lot less positive tests, and that's what I'm looking for.
Governor, you're obviously really stressing social distancing. Is there an update on any stricter enforcement for that? And if someone sees a group of people, what's something they can do or they should do?
Well, what they should do and what I would do, it might be a different story. I would encourage folks to politely say, hey, look, you know, I mean, I've seen it. My sister has told me, my daughters have told me when they're in the grocery store, hey, look, can we spread out a little bit here if you're just polite about it? I think that's helpful. And we are going to see, as we progress through the week here, it's extremely important if we don't get more cooperation. As I said last week on the social distancing, we're going to tighten the faucet a little bit more. So I encourage everyone to please stay home for Nevada. Like I say, my wife and I have been invited to several Easter dinners, and I'm like, geez, you can't have Easter dinner, folks. And this isn't the time to have an Easter dinner of 23 people in your immediate family that you haven't seen since Christmas. This is not the time to get together and have Easter dinner, because there can be a transmission there. And that's something we definitely want to avoid. So I ask everybody, please stay home with your immediate family. Great, go out for a walk with your significant other and, enjoy the fresh air, but avoid contact closer than 6 feet with anybody else.
What could stricter enforcement look like?
Well, if we get to that later in the week, you're going to see what stricter enforcement looks like. Thank you. Yeah, Jackie. Go ahead, Jackie.
The Better Boy Medical Corps, how many signups have you had and how many do you hope to have?
I hope to have one more than we have today. I hope to get as